Okay, thanks everyone for joining us today for the first seminar in 2024, Philosophy and Psychiatry seminar. And welcome to our next series of lectures. The seminar will run for the whole year, but for now we have a program for the first 6 months or so, 7. But you will be updated for the other lectures that will be coming up later next year. So it is my pleasure and privilege to announce our first guest for this year, and this is Stefan Rinner from the Ludwig Maximilian University of Munich. So he specializes in philosophy of language with a strong focus on its applications to the problems of practical and ethical relevance, as you can see, I guess, from the first slide of his lecture. He's currently postdoc fellow at the Chair for Practical Philosophy and Ethics at the Ludwig Maximilian University of Munich. And before that, he was a postdoctoral fellow at the Chair for Logic and Philosophy of Language in Munich, and then an interim professor in theoretical philosophy at the University of Hamburg. And starting in April, he will be an assistant professor in the Chair for Theoretical Philosophy at the University of Essen. And today, Stefan is going to talk about this kind of a interesting new framework of linguistic scorekeeping that will be used to enhance understanding regarding the linguistic mechanisms and interventions employed in talking therapies. So please, Stefan, you can start. Thank you.
Yes, thank you for this introduction and thank you for having me. Can you hear me? Is it good? Yeah, great. Yeah, so that today's talk, today I will present a paper which is somehow the starting point of a larger project financed by the Fritz Thyssen Foundation, which is planned to start in October. So I'm very happy to hear your thoughts and questions on this, because this would be very helpful then for the project. The title of today's talk is also the title of the project, the Therapeutic Game, the Effectiveness of Psychotherapy Explained Within the Context of Philosophy of Language. So according to a definition developed by Norcross, which is also advocated by the American Psychological Association, psychotherapy is the informed and intentional application of clinical methods and interpersonal stances derived from established psychological principles for the purpose of assisting people to modify their behaviors, cognitions, emotions, and or other personal characteristics in directions that the participants deem desirable. So on this conception, the effectiveness of a therapeutic method approach can be measured by the degree to which the participants have been able to modify then their behaviors, cognitions, and or emotions in the desired ways. Here, the gold standard to test this are randomized controlled trials, where one group, the experimental group, receives the intervention being assessed, while the other, usually called the control group, receives alternative treatments or no interventions. However, since supposedly different forms of psychotherapy have shown similar effectiveness, there is considerable debate about which factors are causally responsible for therapeutic change. For instance, there are those who advocate that the specific methods used, also known as empirical supported treatments, are primarily causally responsible for the outcome. Advocates of a common factor approach, on the other hand, maintain that the similar effectiveness of different forms of psychotherapy is best explained by the factors that are shared by the different treatments, such as, for example, the therapeutic relationship and empathy. In addition, there is a third group which maintains that both common factors and specific methods are causally responsible for therapeutic change. For example, according to Norcross and Lambert's estimation of the percentage of psychotherapy outcome variance as a function of therapeutic factors, common factors account for roughly 30% of success, whereas the empirical supporting treatments, ESDS, explain approximately 15% of the variance. The other two factors being extra-therapeutic change, 40%, and expectancy placebo effect with 15%. What is surprising, however, is that neither common factor approaches nor mixed approaches mention a striking commonality of a large number of therapeutic approaches. That is, that the therapy is done verbally in the form of a conversation between therapist and client. This commonality raises the question what role language plays in the effectiveness of the methods and interventions of such talking therapies. The term talking therapy is often used interchangeably with psychotherapy, in particular by a general audience. In this talk, I will use the term exclusively for psychotherapies that rely on verbal communication. So there are also branches of psychotherapy which rely on nonverbal methods. And I'm focusing on the verbal ones. So an approach to language use that has proven very fruitful in investigating the social aspects of language, in particular in the context of hate speech and pornography, is David Lewis' scorekeeping model. According to Lewis' theory, conversations have a score which, together with rules for correct play, determines which utterances are acceptable or even true in the course of conversation. Starting from the scorekeeping approach to language use, the overall aim of this talk and of the connected project is to provide a better understanding of how the methods and interventions of talking therapies work from a linguistic point of view. And the idea is that, according to the scorekeeping model, the methods and interventions of talking therapies are effective by changing the score of the therapeutic conversation. In particular, in the form of a linguistic phenomenon, which I will go into in more detail soon, the linguistic phenomenon of accommodation. And this can affect different aspects of conversational score. For example, the effectiveness of a therapeutic method can consist in a change in belief or an expansion of the possibility permissibility range, to name just a few. And these are all aspects of conversational score. In addition, the therapeutic methods and interventions can be effective by making certain utterances of the client possible. For example, utterances about certain events or one's attitudes and feelings. Using the scorekeeping model, this will be explained by the fact that the therapeutic method or intervention changes the conversational score so that new utterances count as correct play in the course of the therapeutic conversation. In this way, the scorekeeping approach to language use promises a completely new understanding of talking therapy and its effectiveness. And this then has significant implications, I argue, for the therapeutic practice, as it highlights the importance of training therapists in the linguistic aspects of therapeutic methods and interventions, in particular in the linguistic phenomenon, which we will soon talk about, of accommodation. And in addition, the complexity of therapeutic conversations requires the scorekeeping model to be further developed, which in turn would lead to a better understanding of language itself, which is also interesting to philosophers of language. Note that the aim is not of the project is not to provide a common factor explanation of the effectiveness of talking therapies, reducing everything to linguistic methods. The results of this talk and of the project should rather be incorporated into a mixed approach, which also considers other aspects of psychotherapy, other therapeutic factors, such as the therapeutic relationship and the use of empirical supported treatments. However, most of these factors cannot be assessed independently of the fact that talking therapy is done verbally. For instance, the therapeutic relationship is to a large degree a result of the conversation between therapist and client. Similarly, the specific methods and interventions of the different approaches of talking therapy are delivered verbally, which is why in the terminology of the scorekeeping model, they are just different ways of changing the score of the therapeutic conversation. Or to say it with Carr, therapists must engage in specific forms of therapy for common factors to have a medium through which to operate. Hence, the fact that talking therapies are done verbally in the form of a conversation is not only a common factor of these therapies, but it's also a basic factor. Sorry. Which significantly affects most of the other therapeutic factors. And this emphasized again the importance of investigating the linguistic aspects of psychotherapy, prior sorting through insights from philosophy of language and linguistics. In the next section, I will discuss the scorekeeping approach to language use in more detail. Then in section 2, I will develop an explanation of how the methods and the intervention of talking therapies work from a linguistic point of view. This will be illustrated using the example of systemic question and the use of transference and countertransference in psychodynamic approaches. And concluding, I will briefly address the question how the therapeutic relationship affects the linguistic phenomenon of accommodation. And this will point towards a completely new understanding of both the effectiveness of the therapeutic relationship and the linguistic phenomenon of accommodation. So to start the scorekeeping approach to language use. In his seminal paper, Scorekeeping in a Language Game, David Lewis famously compares conversations to playing baseball. For Lewis, just like baseball, conversations have a score, which together with rules for correct play determines which utterances are acceptable or even true in the course of conversation. Now, while the score of a baseball game is acceptable of numbers consisting of the runs of the visiting team, the runs of the home team, the half, the inning, the strikes, the balls, and the outs, the score of a conversation consists of the underlying circumstances that make a conversation possible. And these circumstances contain, among other things, a set of presupposed propositions. For example, an utterance of even the Dodgers could win is only acceptable if its presupposition that the Dodgers aren't favored to win is already entailed by the shared beliefs, common ground, and the presupposed propositions of the conversational parties. So it has to be in the score of the conversation in order for an utterance of even the Dodgers could win to be acceptable. And this makes these presupposed propositions an important aspect of conversational score. Other aspects of conversational score are standards of precision for vague terms, boundary between relevant possibilities and ignored ones, and the boundary between permissible and impermissible, and the like. For example, an example for standards of precision of vague terms, which are important for the appropriateness of an utterance. Take the example of an utterance of Italy is boot-shaped. This utterance is true if and only if the standards of precision for boot-shaped are in place in conversations are such that Italy counts as boot-shaped. And Lewis compares this to the fact that in a baseball game, it is correct play that the batter advances to first base if the score counts 4 balls. For all similarities, however, there is a crucial difference between conversations and baseball games. That is regarding the rules that determine the kinematics of the score. Unlike baseball, conversations have so-called rules of accommodation. For example, if in a baseball game the batter walks to the first base after only 3 balls, which is an incorrect behavior, this behavior does not make it the case that there are 4 balls so that the score changes and the behavior becomes correct. Conversations are different, according to Lewis. And he illustrates this using the example of presuppositions. So even if the score of a conversation does not already include the proposition that the Dodgers aren't favored to win, an utterance of even the Dodgers could win results in the score adjusting in such a way that the utterance counts the correct play. So it becomes part of the score that the Dodgers aren't favored to win. Unless, so one has to say, unless somebody objects, hey, wait a minute, I didn't know that the Dodgers aren't favored to win. So there are possibilities to block it, but if no blocking occurs, and blocking is not very common in such cases, but if no blocking occurs, then the score will adjust. It would not be the case in baseball. In baseball, the score does not adjust if nobody objects, hey, what are you doing? A similar rule, such as this accommodation rule for presupposition, has been discussed by Katunen and Stolnaker. However, Lewis points out that accommodation rules also exist in connection with other aspects of conversational score. So So we've seen other aspects of conversational score. For instance, an utterance of Italy is boot-shaped can lead to the standards of precision for boot-shaped, adjusting in such a way that the utterance comes out true. Similarly, in Louis' example of a master-slave game, where the two people are both willing that one of them should be under the control of the other, an utterance of the master that such and such course of action are permissible or impermissible expands or restricts the permissibility range if this is required to make the utterance of the master true. So this is the phenomenon of accommodation. And against this scorekeeping approach, philosophers such as Abbott objects that accommodation is much like a magical process. And Gorka expresses similar concerns. However, starting from Stolnaker's conception of score as common ground, Thomason and von Fintel could very much demystify Louis' accommodation rules, at least those for presuppositions. According to Thomason and von Fintel, following an utterance of even the Dodgers could win, the conversational parties adjust their beliefs because they recognize two things. One, that the speaker wants to add to the common ground that even the Dodgers could win. And two, that this is only possible if it is already entailed by the common ground that the Dodgers are in favor to win. And now von Fintel mentions two cases where the hearers are disposed to cooperate with the speaker in this way. One, the hearers may be generally agnostic as to the truth of the relevant proposition, and they may assume that the speaker knows about its truth and trust the speaker not to speak inappropriately or falsely. And two, the hearers may not want to challenge the speaker about the presupposed proposition because it is irrelevant to their concerns and because the smoothness of the conversation is important enough to them to warrant such a little leeway. Hence, for Thomason and von Fintel, accommodation is not something magical, but something utterly pragmatic, one could say. Now, there have been significant developments of Louis' scorekeeping model, in particular in the context of the philosophical discussion of hate speech, that is speech that promotes hatred toward an individual or group on the basis of their race, gender, nationality, or the like. For example, philosophers such as Ray Langton and Caroline West and also Mary-Kate McGowan have argued that accommodation plays a crucial role in connection with the attitudinal, emotional, and behavioral changes that come with hate speeches. For example, if a speaker utters the sentence, "Even George can read," the hearers tend to adjust their beliefs so that the utterance counts as correct play. But this means that they start to believe that George has intellectual deficits. And Langton then extends this explanation to desires and feelings. So she adds to the conversational score presupposed desired and feelings. In this way, the scorekeeping model provides an explanation of how speech, and in particular hate speech, brings attitudinal and emotional changes about, even if the speaker has no intellectual or social authority whatsoever. So Langton's development goes beyond belief. This does not only hold for conversational contributions using presupposition accommodation, but also for utterances that lead to the adjustment of other aspects of conversational score, such as the standards of precision for vague terms. For instance, if a speaker utters the sentence, "Italy is boot-shaped," the standards of precision for boot-shaped tend to adjust so that the utterance comes out as true, and thereby add that Italy is boot-shaped to the common ground of the conversational parties. And something like that could be used in the context of hate speech with vague terms. If successful, such conversational contributions even change what future moves are permissible or even possible in the course of the conversation. For instance, if successful, an utterance of "Even George can read" may license making snide remarks about George or jokes at his expense. Therefore, McGowan calls conversational contributions, especially those using accommodation rules, covered exercitives. So exercitives are speech acts that enact rules or permissibility facts. For example, if a lawmaker declares that it's not allowed to smoke in the vicinity of a pregnant woman, this utterance said under the appropriate circumstances makes it the case that it's not allowed to smoke in the vicinity of a pregnant woman. Usually, such speech acts require the speaker to have a certain kind of authority in order to be successful. However, McGowan notes that conversational contributions can change what future moves are permissible in the context of a conversation without satisfying the felicity conditions of standard exercitives such as authority, speaker intention, and hero recognition. And as we have seen with the example of even George can read, this makes such conversational contributions vulnerable to exploitation in socially relevant contexts such as hate speech. So McGowan's idea is that just by participating in a conversation, my contributions alter the score of the conversation. And by altering the score of the conversation, I change the permissibility facts regarding what can be said in the course of the conversation. That's the idea. And the example of the lawmaker also shows that some utterances depend for their appropriateness on the social role of the speaker. Therefore, Popper Wyatt adds so-called discourse roles to the conversational score. These roles determine what can be said by the conversational parties and are typically inherited from their social roles and the norms that come with them. For example, an utterance of I hereby declare you husband and wife is only appropriate if the speaker has a social role that allows them to marry people. In addition, the appropriateness of an utterance can also depend on the discourse roles of the hearers. And here, Popper Wyatt uses an example with a slur, which I don't want to repeat, therefore I just use the placeholder. If I say something like Johnny is an ass, where S stands for a slur, then this utterance is only appropriate if Johnny has been assigned a certain subordinating discourse role. But if this discourse role has not already been assigned to Johnny, the conversational score will straight away adjust so that the utterance counts as correct play. And this in turn relies on further derogatory remarks about Johnny, emphasizing again how accommodation can be exploited in hate speeches. So this is to give you a rough idea of this scorekeeping model and its different developments in connection with hate speech. And now I will say how this can be used in connection with therapeutic conversations. So let us turn to therapeutic conversations. According to the scorekeeping approach to language use and its different developments, the methods and interventions of talking therapies are nothing other than covert exercitives which change the score of the therapeutic conversation. And this suggests that the effectiveness of these methods and interventions is largely due to this change in score. After all, many aspects of conversational score are highly relevant when it comes to the effectiveness of talking therapies, such as the shared beliefs of the conversational parties, their discourse roles, and the permissibility range, to name just a few. Hence, by changing the score of the therapeutic conversation, the therapist can change the client's beliefs, expand their possibility and permissibility range, and the like. Furthermore, by changing the score of the therapeutic conversation, the therapist can make certain utterance of the client possible. Utterance about certain events or one's attitudes and feelings. As Bennebaker and others have pointed out, and also Lieberman, this is often what makes a therapeutic method or intervention effective. So the basic idea is that the methods and interventions of talking therapies are effective by changing the score of the therapeutic conversation. By changing the score of the therapeutic conversation, the therapist can change the beliefs, desires, feelings, and behaviors of the client. But therapeutic methods can also be effective by making certain utterances possible on the part of the client. And according to the scorekeeping model, this can be explained by the fact that the therapeutic method changes the conversational score so that new utterances count as correct play in the course of the therapeutic conversation. This is the basic idea. And now there are two ways, according to the scorekeeping model, in which the therapist can change the score of the therapeutic conversation. First, the therapist can change the score of the therapeutic conversation with their own conversational contributions, in particular, those using rules of accommodation. since such utterances in turn change what future moves are permissible or even possible in the course of a conversation, in this way the therapist also indirectly affects future scores of the therapeutic conversation. In addition, the therapist can affect the score of the therapeutic conversation by blocking the conversational moves of the client. In this case, the therapist makes a conversational move that prevents an utterance of the client from changing the score in a certain direction. Again, such blockings do not only prevent that the conversational contributions of the client change the score directly, for example, by using a rule of accommodation, they also prevent that certain conversational contributions that the therapist would like to make later in the therapy become unacceptable. So, and let me briefly, this can be illustrated using the example of systemic questions. Let's go back to our setting. With the use of a systemic question, the therapist usually wants to provide the client with an alternative and possibly less problematic description of reality. For example, if a mother utters the question or the sentence, "My son is bad," then the therapist could respond with the systemic question, "What is your son doing that you call bad?" With this question, the therapist implicitly provides the mother with a less problematic description of reality, according to which a behavior of the son is perceived as bad instead of the son having the property of being bad. If the mother responds with an utterance of "he throws things around," then she has accepted the implicit offer of the therapist. And systemic questions are often described an almost hypnotic effect, since clients tend to tacitly accept their implicit offer. This is why Schmidt describes systemic questions as a kind of hypnotherapy. And it's very likely that the almost hypnotic effect of systemic question can be explained by the fact that their implicit offers are presuppositions that are accommodated by the client. So if the therapist utters, "What is your son doing that you call bad?" then the question of the therapist presupposes that the son isn't bad, but it's a behavior that is perceived as bad. And if the mother doesn't block this move, this conversational move by the therapist, then uttering this question leads to the score accommodating in such a way that it includes that a behavior is perceived as bad and the son doesn't have the property of being bad. And the reason for this is that the therapist's question is only appropriate if the score is such that it includes that a behavior is perceived as bad. So this is the idea. In addition, the scorekeeping model provides an explanation of how exactly systemic questions open up alternative and possibly less problematic descriptions of reality on the part of the client. By changing the conversational score, the systemic question, "What is your son doing that you call bad?" makes new utterances possible in the context of the therapeutic conversation. That is, utterance that presuppose that the behavior of the son is perceived as bad. For example, this is the reason why an utterance of "he throws things around" by the mother would be, following the therapist's question, appropriate in the course of the conversation. Finally, the use of the systemic question also blocks the mother's conversational contribution, "My son is bad," preventing the score from changing in such a way that it includes that the son has the property of being bad. So if the mother in the therapeutic setting utters the sentence, "My son is bad," then if the therapist wouldn't react, this would become part of the score of the therapeutic conversation, which would make it quite difficult for the therapist afterwards to react to it. And by reacting immediately with the question, "What is your son doing that you call bad?" the therapist says something that presupposes that it's not a behavior of the son that is bad, but that is not a property of the son to be bad, but that is a behavior that is perceived as bad. And by this move, he then also blocks the score from accommodating in such a way that it includes that the son has the property of being bad. So the therapist's question has two functions here: blocking the contribution by the mother and making his own contribution that a behavior is perceived as bad. Sorry. So note that in the example of systemic questions, the use of accommodation directly leads to the intended effect of the therapist's intervention, that is, providing the client with a less problematic description of reality. That would be that a behavior is perceived as bad and that the son doesn't have the property of being bad. Accordingly, the effectiveness of the intervention depends to a large extent on the use of accommodation. After all, an explicit utterance of the therapist's implicit offer, so if the therapist would have said, your son isn't bad, but the behavior of his son is perceived by you as being bad, this probably wouldn't have the desired effect. However, the causal connection between the use of covert exercitives and accommodation on the one hand, and the intended effect of the respective therapeutic method or intervention on the other hand, is not always that obvious. For example, if Popper, White, and White are correct about the accommodation of discourse roles, so that also discourse roles are part of the conversational scores, then it's very likely that the effectiveness of transference and countertransference in psychodynamic approaches depends to a large extent on accommodation rules for the discourse roles of therapist and client. And according to this explanation, in transference, the utterance of the client and the therapist result in the score adjusting in such a way that the therapist suddenly takes on the discourse role of someone from the client's past, making it possible then to process unresolved conflicts with this person. Similarly, the client could take on the discourse role of one of their past selves. And in such a case, accommodation does not directly result in the intended effect of the examined method, that is to process unresolved conflicts, but it is nevertheless decisive for its effectiveness. So we see that according to the Scorekeeping model, therapeutic methods and interventions can affect different aspects of conversational score. Hence, in order to get a better understanding of how individual methods and interventions work from a linguistic point of view, we have to investigate which aspects of conversational score are affected by the respective methods or intervention. What all different methods and interventions of talking therapy have in common is, according to the Scorekeeping model, that they are covert exercitives, and as such, they change the score of the therapeutic conversation, possibly but not necessarily using the linguistic phenomenon of accommodation. And this has significant implications for the therapeutic practice, as it highlights the importance of training therapists in performing and in blocking covert exercitives using rules of accommodation. And the latter would also require that the therapist be trained to recognize the performance of potentially problematic exercitives on the part of the client. For example, Spisa carried out an empirical study that shows that speakers can be trained to identify potentially problematic presuppositions of an utterance. Similarly, Langton notes that speakers can be trained to block problematic presuppositions via explication, paraphrasing, a raised eyebrow, a joke, and the like. So we can sum up the main ideas. Investing the linguistic aspects of the different therapeutic methods and the intervention of talking therapies, starting from the Scorekeeping model, constitutes a research field in its own right. The primary aim of this talk was to provide a general understanding of how the methods and interventions of talking therapies work from a linguistic point of view. And accordingly, the effectiveness of talking therapy, of the methods and interventions of the various forms of talking therapy depends in large part on the performance of conversational exercitives, in particular those using rules of accommodation. And this was illustrated using the example of systemic questions and of transference and countertransference. And now, concluding, I will briefly address the question how the use of covert exercitives and accommodation interacts with another important factor for the effectiveness of talking therapy, that is the therapeutic relationship. The only way to prevent accommodation is by blocking. So, for example, if the therapist in our example uses the systemic question, what is your son doing that you call bad? The mother could respond with an utterance of, what do you mean with called bad? He is bad. In this way, she would prevent the score of the therapeutic conversation from adjusting in such a way that it includes the behavior of the son is perceived as bad. Hence, if the effectiveness of the methods and intervention of talking therapies depends in large part on the performance of covert exercitives, using, for example, rules of accommodation, the effectiveness of these methods and interventions can be expected to strongly correlate with the blocking behavior of the clients. So if the client always blocks the moves, then accommodation cannot work. Therefore, it is important to investigate what influences the client's blocking behavior. For example, if the mother blocks the presupposition of the therapist's utterance in the described way, it won't count as correct play. This in turn would amount to an interruption of the conversation. And it's very likely that this is the main reason why listeners tend not to block the conversational moves of the speaker, because they usually have a strong interest in keeping the conversation going. The reasons for this can vary. However, it is plausible that listeners have a strong interest in keeping a conversation going if they want to build or maintain a relationship with the speaker, especially in the context of therapeutic conversation. This suggests that the degree of blocking decreases if the importance of the relationship to the conversational parties increases. Together with the claim that the effectiveness of the methods and interventions of talking therapy depends in large part on the use of covert exercitives, in particular those using rules of accommodation, this promises a completely new explanation of why the therapeutic relationship has such a large influence on the effectiveness of talking therapies. And the idea is that by reducing the blockings on the part of the client, the therapeutic relationship increases the effectiveness of the therapeutic methods and interventions. Now, this has to be tested empirically. So the influence of the relationship of the conversational parties on their blocking behaviors, this is an empirical matter, and this has to be tested empirical, which goes beyond the scope of at least this talk. But a confirmed correlation between blocking and certain aspects of the relationship of the conversational parties would not only provide a better understanding of how the therapeutic relationship affects the effectiveness of the methods and interventions of talking therapies, but it would also contribute to the demystification of the linguistic phenomenon of accommodation, which, as we have seen before, is described by some as a somehow magical process, by providing an explanation of why speakers tend to adjust their attitudes and feelings so that the utterance made in the course of a conversation counts as correct play. And this illustrates again how research at the intersection of psychotherapy research and philosophy of language can be highly beneficial for both research areas. Yes, thank you.
Okay, thank you, Stefan. That was very interesting. As you summed up at the end, I think you, in a great way, illustrated why philosophy is important or could be used, and in this case, it was philosophy of language, to somehow analyze certain problems that are there in psychotherapy or psychiatry in general, and maybe philosophy can in some ways help resolve those problems. So we open up the discussion now for questions. So this is both for people online and here at the Institute. Do we have any questions? Okay, we have one question here from the Institute. You can stop sharing the presentation if.
Yeah, thank you. Thank you, Stefan, for this super interesting talk, actually. I myself am working in the philosophy of language, albeit from the perspective of philosophy of cognitive science. So, and especially the role of large language models for understanding the human linguistic competence. So this was actually really interesting for me. And I was wondering whether you have thought about this. Well, everything you say goes for human therapists, right? The relationship between human therapists and clients. However, recently there has been a resurgence of clinical chatbots, and there was also some empirical studies stating that people are more, well, at least feel more free in that digital setting rather than in-person setting. So have you thought about how this account could be applied to that context as well?
Not extensively thought about it, but yeah, that's an interesting. It's an interesting point, in particular in connection with the last point I'm making regarding the the factor of the therapeutic relationship, what factor does it play? Because if it is the case that the clients feel more free to talk about their attitudes, feelings in connection in the context of having an electronic in an electronic way without a real human, that one could say that questions this last point, and that's an interesting point to think about. Yeah, I mean, so the linguistic model would work in the same way. So that's so that would maybe also explain why it works, because it is the linguistic aspects play such a big part. So one could say is the reason why it works. And then the interesting question is, but why does the therapeutic relationship has such a strong impact on the effectiveness of psychotherapy, or at least in the effectiveness of these methods? And then, yeah, then a question mark comes with if it also works in the non-human setting, if it is the linguistic factor or not. But that's an interesting point. I have to clearly think about it.
Yeah, that's fine. I mean, me too. I was, for instance, I was wondering how would this blocking behavior of clients could be deterred in such a context, because this therapeutic relationship with well, real therapists is more direct.
Yeah, I mean, if one this would have to be tested empirically, but if the blocking behavior would be similar, then one could say that the only reason the blocking behavior is similar is because one wants to keep the conversation going, even with a non-human. I have when I start such a conversation, I probably have an interest in getting help, and I know I can only get help if I keep the conversation going, basically. And so this would, and if it would be the same in both contexts, then this would be the simple explanation probably. And then one could say, well, it's not it's not that we have a human relationship that makes it work, but just our how can you say, just our egoistic motive or reason to keep it going. Yeah.
That would work for me, but yeah.
Yeah.
Thank you.
No, thanks for the point. That's very interesting. That's an interesting point.
Okay, thank you, Vanya, for your question, and Stefan. Do we have any more questions? If not, maybe I'll do a quick one. So I find this very interesting, very useful, and I was just wondering, maybe this will be something that you work on later on in a different paper or something like that. But what there may be a distinct differences between different talking therapies, in terms of this scorekeeping game, or could this model show us, just putting it simply, what kind of a talking therapy, or more concretely, is better or worse or useful for this kind of disorder or that? Could this model be used to be more precise about which therapy is just basically better than some other therapy or talking therapy in certain terms for certain disorders and so on?
I don't know if better, because I think what is better is would be a question regarding what has what is better for the clients, what works better for the problems of the clients. Not so that I wouldn't say that this is would be a linguistic model to decide. But what the model shows is that there are similarities or strong similarities between the different kinds of talking therapies. So the idea would be that it's always a conversation that has a score. So the effectiveness can only, if the effectiveness is based on the conversation between the therapist and the client, then according to this linguistic model, it has to be traced back to the change in conversational score. And so the different methods of the different approaches of talking therapy, they would just be different ways of changing the score.
Yes. Yeah. Okay.
And then one could maybe there is then something where one can say this works better than the other thing because it changes the score more directly, and this needs is only indirectly changed the score and therefore is not that effective. So maybe, but I'm not sure. I would more point the finger towards the similarities which are according to this model there.
Oh, okay. I see. I think you're right. So there's this question that I got through the chat. Maybe I can just read it now. So the therapeutic change in the cognitive behavioral therapy is in large part driven by changing irrational beliefs about some adversities in a person's life, which are changed via talking to the therapist. So these beliefs are based on how we talk to ourselves also. Do you have any comment on that based on your work on the language games?
I mean, this would be it should be possible according to the model to trace this back to change in the what I call presupposed propositions or the common ground between the therapist and the client, so that if you have a lot of irrational beliefs and are able to change them in the course of a conversation with the therapist, this should be due to the fact that the therapist helps and you develop a set of presupposed propositions via your conversational contributions, which is less problematic or less irrational, so to say.
Okay.
So it's very similar as the case with the systemic questions, where you also want to provide the client with a less problematic worldview, so to say, or description of reality.
Okay, thank you very much. So that was a question by a psychiatrist, just so you know.
Okay.
We have another raised hand, so go on, Themistocles.
Hello, good morning.
Hi.
Thank you for your talk. I think the AI, the language model question can be answered in terms of course, there is a score being kept between a language model and a client, just like in any conversation. But I think the explanation for why that wouldn't work, if it didn't work, would be that humans, I feel, are more disinterested in that score. Like they don't care enough about keeping a score with a language model. So then my question would be, according to the model that you proposed, what is the difference between a therapist and a friend? If it's about scorekeeping, can't a friend do that in exactly the same way as a therapist would?
Well, the difference would be that the therapist is trained in maybe unconsciously keeping the score with certain methods. So he has certain phrases, certain ways of asking questions, which are different. For example, maybe a very simple example would be that while the therapist would use a systemic question to provide you with a less problematic description of the world, friends usually would say it directly. Yeah, well, it's not a behavior, it's not a property of your son that he is bad. It's just his behavior. And maybe this is less, and the therapist does it in a more subtle way. So he uses, maybe unconsciously, he uses this linguistic phenomenon of accommodation more because it is implemented in his methods, which he has been trained to use. Whereas friends would be not that trained, and therefore would probably use the phenomenon of linguistic accommodation less, and try to change your beliefs with more direct utterances, such as, well, it's not a property of your son. It's It's his behavior. Get along with it. So something like that. And the therapist does it in a more subtle way. And thereby, I think unconsciously, they use the linguistic phenomenon of accommodation, which makes it easier to change the score of a therapeutic conversation. But in principle, a friend could do it. That's and it's also the reason why conversations with friends sometimes have a therapeutic effect on us.
So by that logic, a friend who's a trained therapist would be an appropriate therapist.
Yeah. I mean, it's always there are other aspects to consider because maybe you don't want to talk with a friend about certain things. So in this way, as I said, the discourse role, which is implemented by the social role, also somehow affects what can be said in the course of a conversation. And maybe a friend in some connections would have a discourse role which makes it unable for us to utter certain things or what have you. But in principle, friends, that's one aspect of friendship is that we can talk with them and maybe develop a score which is better for our lives than the one that we have before. So something like that.
Thank you.
Thanks.
All right. Thank you both. So we have another question from the chat. Are there moral risks that therapists trained in actively keeping in mind and influencing these linguistic aspects of the therapeutic conversation need to be trained to recognize? Are there ways of changing the score of a conversation that, although perhaps conductive to the ultimate therapeutic goal, are morally objectable, perhaps because they're unacceptable forms of influencing or manipulation?
Yeah.
I'm thinking here roughly analogously to how someone trained in rhetoric is not morally allowed to get people to believe in whatever way they can, but must also always respect their interlocutors.
And that's a very good point. Yeah, that's also something I want to think about more in the course of the project, of the ethical implications this has for the use of therapeutic methods. So because, as we've seen in connection with the systemic use of the systemic question, it has also somehow something of a manipulation, of manipulating the client. Because when we say that as a presupposition, the client accept it, it is more likely that the client accepts what I'm saying than when I explicitly say it. Then one could already argue, well, then you are manipulating him. When you use it, when you try to say it to him with the use of a presupposition. So yeah, that's a very good point. Yeah, that's definitely a problem, that accommodation can also be used to manipulate. And when do we then say that it's morally acceptable to use it?
Okay, excellent. Thank you for your question, Joe. Do we have any more questions or comments? If not, let us all thank Stefan for his excellent lecture. I hope that this discussion was useful to you for
thanks.
your work, and
Great.
hope we'll see you again here at the seminar as a participant or listener.
Yeah, thanks.
Thank you again, and everyone, see you, I think, in about a week or two. So we have first lecture is beginning of February. Okay, thank you, everyone. See you again.
Thanks. Thank you for having me and for the questions.
Thank you.
Bye.
Bye.